Hi, I'm Dr. Hirdesh from Height Increase Info. So we have one tibial lengthening patient. He lengthened 5 centimeter in bilateral tibia and it's been 4 months from starting to now.
Yes, you're right.
And now it's time to go home. So we will know his review till now, how he feeling after lengthening, and in frame, how much pain you suffer and how was your activities and how's your whole experience with us.
Okay, where should I start? Okay,
And can you start from beginning?
yeah, I did this surgery 4 months ago, so it means at the beginning of January, 8 January to be precise. And it's true that it's a bit hard the first weeks because it's a shock. I didn't know much about the surgery. Even I did my research, this is completely new for me. And it was a bit difficult in terms of pain, but very fast after 2 weeks it started to decrease. And also mentally, you have to take time
to accept this.
to accept the idea that you did a major surgery, but then after 2 weeks it slowly starts to decrease gradually the pain, and you get used to psychologically to your new reality. It's true sometimes you can feel a bit frustrated because you depend on people, so it's very psychologically, but along the time, after 1 month, it gets better and better. The period I was wearing the external fixator was from 8 January to 20th March. So it's a bit over 2 months, and this is the most difficult because you have an external device on your body where you're not used to. It's a bit difficult to sleep, but you get used.
So how long it took to accept that external fixator? You have something now, you can adjust with those fixator for
1 month for me, 1 month, maybe a bit less, some people a bit more, but around that month mark you start to already accept, and your fixator.
Is that painful? Because it looks painful, but
Yeah, it looks painful. I think we'll say it looks more scary than really is. This surgery has been ongoing for many not centuries, but many decades. It was created by Dr. Ilizarov. We are talking about the 50s, and has been already several decades. This surgery has been performance undergone for people who has discrepancies. So it's not quite new, but I understand for the untrained eye of a sudden see this is very shocking. But if you do your research, and you will find out that it's possible. Many people has done it before. It's a bit shocking. It's a bit difficult because it's a fixator, but it's 1 month. Then you have to undergo this period. Can be a bit inconvenient, but you can do it. It's everything in your mind, a big part, and very important to go to the gym as much as you can, be active as much as you can, try to eat well, try to take the supplements, have also psychological support, having friends here, talking to their patients, trying to be positive, do your research. All these things are important.
okay. And activity-wise, how was your activity in frame?
Yeah, during frames, my activity was severely reduced compared to now, right after the external device removal. So maybe during the frame period, I used to go to the gym a couple of hours per day. So just a bit of workout, upper body workout, maybe 1 hour, and then 1 hour for stretching and also physio, and maybe a little bit of walk, not that much.
And after removal?
Yeah, I'm one of those guys who I would say is one of the most actives maybe here, I find out. So for me, in my case, right after the removal, let's say max 1 week after the device removal, I was already doing 2 or 3 hours in the morning and then 2 or 3 hours in the evening. So I think everyone who do after removal between 3 and 4 hours, cautiously, it's gonna be very good for them because you're active. So it means cycling, when you can already do treadmill, do some walks on the bars, upper body workout.
It's very important to keep you active.
And try to gait training when you look at yourself in the mirror, with support of course, but try to be active, and that's very important. Yeah.
And now they are walking with crutches, even without crutch also you can walk. How you felt when you start walking first time, when you stood up after the lengthening?
It's very, very gradually. So there is not a moment wow, you pass from but the first time when it was in the walker, it was very, how would say, I was feeling very happy that I was able, and when you walk, but the biggest one is when you start to walk with 2 crutches. I think the moment you go with 2 crutches, you feel almost human again. You say, okay, I've done it. Now from now on, it's going just to get better. I mean, you are already walking, so there is no way back. It's not like your legs are giving up, and that was great. And I think for me it has been 7 weeks post device removal, only 7 weeks, and I'm already walking with 2 crutches, with 1 crutch, and sometimes I can do few steps even without crutches, but not for a long time. But I can do definitely with I can do walk and from. So it has been. I think I've recovered very fast, and my progression has been very good in the last 7 weeks because the work I put in. Also been lucky, of course, and there's no much. The work, Georgian, yeah, that's it. Being shape also helped before this surgery.
Okay. So what was the reason behind this?
Where I come from, West Europe.
And you lengthen very minimum amount of lengthening. 5 centimeters is very safe and
Yeah, before coming here, there are several factors. One, I've been very aware of my wingspan, which is a bit short for the average. I mean, it's not short, it's the same than my height. It was 5'5". If I would have like a wingspan longer than my height, maybe I would fit. So that was one reason I didn't want to extend too much because maybe it looked weird. But the most powerful reason was I did want to take any risk.
okay.
And I wanted to come back to 100% athletic capacity.
Okay.
I want to regain. Of course, I can do 6, 7, and you're gonna be able to walk and run and everything. But for me, it was about not only coming back to run, but run as fast as before, sprint as fast as before, jump as fast as before. So that's why I want to be conservative, because I wanted to harm my athletic marks.
Great. So now you're satisfied with.
Yeah, because you can always go for a second segment if you really. I think it's very good when you just do one tip, one segment. You take your time to rest, and you go back to your country. In my case, you feel how you feel, and then okay, it was good, but still I need a bit more of height. Then you can always go to femur. The centimeter that you did not do extra in your tibia, you can do in your femur. And femur also you can lengthen a bit longer.
Bit longer than tibia.
Also tibia, I believe, like it takes a bit longer to recover for tibia because you are breaking 2 bones.
Yes, 2 bone plus most of the reason your ballerina, your ankle, Achilles tendon.
And this takes time because it's connected to your gait extreme, because it's connected to your ankle. So the gait, I didn't want to change my gait or like take long time to walk normal.
Normal, yeah. And why you choose India for lengthening?
Well, I choose India, to be honest, for economic reasons. In other countries, it will be slightly more expensive than here. And on top of that, you have a limb lengthening center. I believe in this kind of surgery, it's better to have all in one. So you cannot just isolate this. I mean, you can do it. There is some centers in the world, and you do the surgery, and the right after they send you 2 days to your home, and then you have to outsource, hire the physician for one place, then the caretaker for another, the gym. So it will be much better to be everything.
And if you have anything related to surgery,
Yes.
go back to your doctor for the checkup.
And everyone knows your history. So you have like, here is good because you have a building where you have like a gym where you can go and work out. You have physiotherapy twice per day, so they are with you and do the physiotherapy. You also are here in the building, so if there is something going on. You also have a driver who can just get you medicines at any given time. If you have pain in the middle of the night, you can call one of the guys working here and they can just bring you any medicine, or they can be next to you. Also, you have the support of other patients, because when you do with a surgeon and then send you back home, if there is no other guys who has done this surgery or has been in the same position than you, here everyone is in different stages of this process. So you know the new ones, I can give support to the new ones. The new ones see me walking in the gym and they say, oh, this guy's walking. So they say, it's possible. You see, there is another guy. So you are not isolated. You see other guys. And also, when I was here, I see other guys who were more progress than me. And that thing is very, very useful.
So you want to say anything about the height? Why height is more important? It's just a psychological thing, or it matter in society also?
It's sincerely, I would say every person here has some story behind. In my case, as many guys here, was related to childhood. So when I was a child, as many guys, I was bullied because of my height. You have your grandma, your auntie, who compares your height with your cousin's height. Oh, you are not growing up as much as Pedro. And then you become this complex. Some guys suffer some rejection for a woman who told them you're too short, and they get a stick on that. And other guys, I think they think their problem is their height, but it's not really. Maybe they are very introvert, or but they identify their problem is the height, but it's not really the height. But it's in their mind, so for them it's height, so they do it.
So you want to give any suggestion for them who is planning for the limb lengthening surgery in future?
Yeah, first prepare before coming here. Stretch, be light. Try to lose weight, not like super skinny, but try to be in a weight where you can, with your hands, for example, if you can do 50 push-ups, 30 push-ups, it means you are strong, but in terms that you can hold your own body weight. Because most of these things, especially after external removal, you have to handle scratches, you have to use walker, so you want to be exhausted because you cannot bear your own weight. So be strong in your upper body, have a healthy weight, stretch, be flexible, and also be mentally prepared that you're gonna spend here a few months and maybe even longer than you expect. And also I would recommend this surgery for the kind of guys who are very, very aware of their height. Not the kind of guy that say, yes, I would like to be taller, but he really doesn't mean it. Everyone would like to be taller. It means guys who really have some trauma, or they have been thinking about being taller for years, or they been sure impact the way they see around, like they have to have like very strong complex. This surgery is not for a person who say from 1 minute to another, yeah, we'll go taller, and do no research at all, just doesn't know.
No, we have patient. They already said it. I did this thing because I want to go on vacation.
Yeah, we have someone who say that. I think it's
It's just stupid.
very stupid. It's quite deceiving. I think you have to be. It's not like the kind of person. The guys who come here is people who have been with trauma, bullied, or they see their height like an obstacle to their professional career. Their romantic relationships impact at all. This is the one that it should go. I wouldn't recommend this surgery to the next man, you know, to the average man on the street.
And last, you want to say something about our height increase info? How you felt? How was your overall experience with us?
I like because there is no many centers which are comprehensive, where you include in the one same building, one same place, physiotherapy, doctor, and the caretaker and everything. I think it's good. It's going probably there is things that it could be improved as anywhere else. I trust that these small things will improve with time. It's just as any other business, it takes time. But in overall, it's very good experience. Overall, yeah, I would recommend to come here for doing the surgery. And as long as you are strong mentally, you are convinced, and you are the right candidate, yeah, I would say so.
Thank you. So this is his 4-month review, and he completed his 5 centimeter height. So now he is still in rehabilitation phase. He can walk while still working for the strengthening and bone growth. So till then, if you have any query regarding limb lengthening, limb reconstruction, number is given below. Thank you.